Together we achieve victory over heart failure.
Namaste. I'm Dr. Shetty. I'm a cardiologist. I practice at Jayanagar. Today we will try to dwell upon some of the critical aspects of healthcare, monitoring of heart failure condition. It's very difficult to notice heart failure in the early stages. As our heart faces increasing strain, it compensates by working harder, and the symptoms may not be appreciated. As the condition progresses, the heart will find it more and more difficult to pump blood to the body, to the entire body, especially when the requirement of the body goes up. This can result in symptoms like breathlessness, increased weight gain, swelling in the ankles, and difficulty in breathlessness on walking. Shortness of breath during activity is one of the important signs, and this can progress over time, resulting in breathless even at rest or when we sleep, or it can wake us up in the middle of the night with breathlessness. It can also present with persistent cough or wheezing. Difficulty to sleep indicates fatigue, confusion, or fainting may be other signs of reduced blood supply to the brain. The other symptoms are like rapid heart rate, nausea, or lack of appetite could also indicate heart problem. If you notice any of these signs, keep prompt medical care. If you notice any of these symptoms, take prompt medical care. The blood pressure normally is about 120 by 80. That is, systolic is 120 and diastolic is 80. An elevated systolic between 120 to 129. Normal blood pressure is about 120 by 80. 120 is the systolic blood pressure and 80 is the diastolic blood pressure. The next important thing to monitor will be the cholesterol. For people less than 19 years of age, the LDL cholesterol should be less than 110 milligrams. And HDL, that is the good cholesterol, should be more than 45 milligrams per deciliter. For men aged 20 and above, the LDL should be less than 100. And in men aged above 20 years, the LDL should be less than 100 and HDL should be more than 40. However, in women more than 20 years, LDL should be less than 100, whereas the HDL is slightly more, above 45 to 50 milligrams per deciliter. The other important aspect is the heart rate. The normal heart rate is between 60 and 100, which is considered as normal. In patients with heart failure, there will be a resting tachycardia. That is, heart rate will be slightly higher compared to a normal person. This makes the heart work more, making it tired early. Heart rate can be easily monitored either by using a watch, and then the maximum permitted heart rate during exercise also need to be monitored so that undue overexercising, which can also tire the heart, should be avoided. So keeping a tab on the blood pressure or cholesterols and the heart rate may help us monitor and identify heart failure in the event it develops to pick up early. Thank you.